This morning on BRN Wellness, diabetic retinopathy rates in youth signal a potential public health crisis. And joining me now is Dr. Julie Rosenthal of the University of Michigan Department of Ophthalmology and Visual Sciences and the Kellogg Eye Center. Dr. Rosenthal, so great to see you. Thanks for joining us on the program this morning.
Thank you so much for having me. I'm happy to be here.
It's great to have you, and it's really great to have you share your expertise. And I want to start off with a basic question, maybe for you, but for the audience. What is diabetic retinopathy?
It's a great question. So the retina is the tissue in the back of the eye where you have all your nerves. So it takes in messages from outside the light that comes into your eyes, processes it, and sends it back to your brain through the nerve in your eye. And so it's very, very important tissue in the eye, obviously. It's really what you use to see. And when someone has diabetes, it can affect the eye in a lot of ways. What we see when we look into the eye in the retina, we can see bleeding in the back of the eye. We can see areas of the retina that don't get good blood flow. We can see swelling in the back of the eye. We call that macular edema. And in the later stages, in the way we have it staged now, we can see new blood vessels that can grow in, and they can leak and they can bleed. They can cause the retina to separate from the back of the eye. And that's what can lead to a lot of vision loss from diabetes. There are all sorts of ways that, we don't measure right now too, as far as how diabetes affects the eyes. It also affects the nerves in the eyes. So it's really, really a very important part of diabetes, and trying to prevent that is another thing that we really, really are trying to do in diabetes.
Yeah, and we're going to talk about that in a few minutes, but let's talk about a trend, and it's a concerning trend. But according to research that you were part of, I believe, younger people, and young to me means something different than someone who's 22. But younger people in our population are actually seeing an increase in this diagnosis. Is that correct, doctor? Did I get that right?
Yes. It was an alarming trend, and actually in research called in two major studies of type 1 and type 2 diabetes in people who get diabetes at a young age. So the SEARCH study and the TODAY study, which I was not part of, but as an ophthalmologist seeing this, I was very alarmed by showing that, we used to think that diabetes really didn't affect the eyes of young people who had diabetes, that they really didn't get diabetic retinopathy or other complications until much later. But these studies showed that, at least 50% of these patients had some form of diabetic retinopathy after, about 12 years of having diabetes, or a mean age of 26, which is pretty young.
Yeah.
So we're very concerned about that.
Yeah, I agree. It's very young. And you certainly, and I guess this kind of tracks, doctor, with overall diabetes is now, we have an obesity issue in this country that I don't think that's a surprise to anyone, but a part of that is diabetes. And so it's actually increasing among our younger population as well.
It is by quite a bit. Both type 1 and type 2 diabetes. So type 1 diabetes is more of an autoimmune disease. We don't think it's as related to things like obesity or other factors. They're both increasing in use.
Yeah. So how do you detect, if I were to have, I don't have diabetes currently, but if I had diabetes, how would you detect that I have this, I'm going to call it disorder, disease?
In your retinas?
Yes.
Well, so there are a few different ways. The mainstay, the gold standard, what we've always done is have you go to your ophthalmologist's office. We dilate your pupils and we look at the back of your eye. We also have different tests that we can do that look at whether or not you have the swelling in the back of the eye. A newer way that people are trying to, get the screening to more people is to take photographs of the back of the eye and have them graded, whether or not by a trained grader, to see if they see the changes from diabetic retinopathy, or even some people are even using AI at this point to grade these photographs. Those only capture one part of the diabetes in your eyes. As we're learning more and more, it may be affecting how the retina functions, how well you can see contrast, how well you can see other things before we even see it in the eye. So I think that's going to change at some point in the future, how we detect it. But for now, those are the ways we detect it.
So if you go to your ophthalmologist for a regular annual checkup or physical for your eyes, you can find this disease, and I would assume, doctor, be able to treat it.
Yes, yes. And there are some things that the sooner we get to, the less likely they are to cause blindness. For instance, those new blood vessels I was talking about that can grow into the eye. We do have treatments for that and to try and prevent you from losing vision, but we need to get to it before it gets to the advanced stages. And that's really the key, is catching it early.
And are there certain parts of our population that maybe don't have access to an ophthalmologist or getting eye checkups? I've been going to an eye doctor since I was like 3 years old, because I've been wearing glass corrective lenses since that time. But are there certain parts of our population maybe that maybe are more predisposed to this disease, diabetes, and this disease, and also maybe don't have access to someone like yourself who has be able to detect this?
Yes, we know that that is an issue. As we discussed in the paper, a very small percentage of those with youth onset diabetes, so either type 1 or type 2, actually get their eye screenings. And there are definite disparities with racial and ethnic minorities not getting the screening that they need. There are disparities in treatment and care as well, which would be a
And
whole long discussion that I know we don't have time for here today. But
yeah, and we're going to have to cover that. And we've covered that in different nuances on different programs. But I agree. Is it so, doctor? Is it a lack of education, maybe not being aware, or a combination of a lack of education and also a lack of resources? So do people, if they want it, can they get access to care?
that's a great question. And I think there are so many layers to that answer. I don't think it's just one factor. I think that probably those things may play a part in it. People not being aware of the fact that diabetes can affect the eyes, being aware of the fact that they need to get this screening. But also, when someone who's young has diabetes, they have a lot that they're dealing with. So, they have to see their endocrinologist. They have to, have control over their glucose. They may be injecting insulin, or they may have a glucose monitor and an insulin pump. They have lots of appointments they have to get to. And so these parents have so much to do that, it can be just really difficult to get your child everything they need. And then, in the older population who are just leaving school or maybe leaving their parents' house, their life isn't maybe not as structured. They're not getting the reminders that they need. They may be converting from a pediatric specialist to an adult specialist. Their friends aren't dealing with any of these things that they have to deal with. And so there's just so much for them to do. I think it can be overwhelming.
Yeah, and I, even though I'm a bit older, I do remember transitioning from pediatric care, and it was hard to kind of, you think you're invincible when, we all did. We all thought that, hey, it's not going to happen to us. Doctor, last question. Are there lessons here for public health officials and also our legislators, public policy folks? Are there lessons here about this disease? I don't want to raise alarm bells, but it sounds like this is a trend going in the wrong direction. It's going up. So are there some lessons that our public health and legislators need to be thinking about?
Yeah, I mean, I think we need to be encouraging more and more diverse ways of children and youth, people those with youth onset diabetes who may be just out of childhood to get this screening. More creative ways, maybe putting cameras in endocrinologist's office, putting different methods of screening, making it easier for these parents to get their kids to the screening, or for these adolescents or young adults to get to their screening, putting in place more options for them to get screening, helping, find a way for these cameras to be anywhere in general that these people can go to without having it be too much of an effort or a burden.
Yeah.
So then once they have this disease, educating, the public would be helpful.
Yeah. I mean, you got to know about it to do something about it. That's, I guess, the first start. Knowing is half the battle, as they used to say on G.I. Joe. Doctor, I don't know why I brought that. I'm really dating myself. Dr. Rosenthal, great research. Yeah, knowing is half the battle. Gee, I used to watch that every morning when I was in grade school. All right, Dr. Rosenthal, great research. Thanks for joining us, and we look forward to having you back on the program again very soon.
Thank you so much for having me. I really appreciate the opportunity to let everyone know about this very important issue.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving. And don't forget, roll with the changes.